Hi, I'm Dr. Ben Quist.
And I'm fitness expert Jeremiah Kruger.
And we've got an exciting one for you today, ladies and gentlemen. We are going to be interviewing 3 of our top physical therapists to give you, our viewers, their advice on how not to hurt your shoulder in the gym. I wonder if they'll all say the same thing.
We'll find out.
I'm here with Brian Gajafsky, one of the physical therapists on our team at Body Renovation, our sister company. And he's going to share some thoughts that he has on things that you can do as a gym goer to preserve the health of your shoulder joint.
Hello. So basically, I usually tell my patients the main function of the rotator cuff is to literally hold the ball in the socket. Ball, that ball needs a compressive force in the socket for it to work correctly. So really, the cuff is working all the time. So by theory, it's a postural muscle. Usually when we work postural muscles, we're working higher volume, lower intensity. So instead of sets of like 8 or 10 or 12, it might be 15, 20, or 25 with pretty light resistance. So loading up that cable with 50 or 60 pounds and doing shoulder external rotation is usually, I feel like, somewhat of a risky thing because really that cuff is just not designed for that. When we're working on, anterior deltoid or actually mainly middle deltoid and long arm strengthening with a dumbbell, this exercise with heavy weight is really effective for developing big delts, but at the same time, it's also a lot of torque on those fine-tuned kind of delicate rotator cuff muscles. So I usually discourage people from really loading up with long arm strengthening, especially above 90 degrees, but really any long, heavy strengthening is a little bit risky.
Dumbbell lateral raise or dumbbell front raise.
Not that you can't do that, but I think you just need to be aware that it's really an endurance muscle, not meant for power. So when you really load up like that, especially above 90, I think we're asking for problems.
How long have you been practicing, Brian?
27 years.
And you've seen
approximately.
I've
seen a lot of rotator cuff issues, and that is pretty much, the Bible when it comes to protecting your cuff. Those 2 main things.
What is the main exercise that you've seen hurt people in the gym? When you have patients come in, they've injured themselves exercising.
Right.
Is there a particular exercise or exercises that stand out?
In terms of rotator cuff, I would say it usually relates to some sort of lateral long arm dumbbell raise.
Okay.
Bar none. I mean, of course, there's other exercises that can be risky, but that's probably number 1. Really heavy overhead pressing can be a little bit risky as well, but probably not quite as much as the lateral arm raise.
Got it. Okay, so postural muscle, higher rep, lower weight. Yep. Don't load up that cable machine with 50 pounds like I see Jeremiah doing all the time. External rotation. So thank you for your time.
You're welcome.
I appreciate it.
Absolutely.
I'm here with Sam Kaufman, another one of our physical therapists at Body Renovation Physical Therapy, and we're going to ask her the same question. What advice would you give gym goers who are looking to preserve the health of their shoulder while they're doing their exercising on the floor?
Number 1 piece of advice would be that form makes a difference. You're at form in fitness. So form for the shoulder is important. Because the shoulder joint is a ball sitting in a socket. The socket is really part of the shoulder blade. So how the shoulder blade is positioned affects the shoulder. When the shoulder blade is tipped forward as the rib cage drops and the spine rounds forward, that shoulder blade kind of dumps the ball out of the socket and reduces the space for important structures between the ball and the socket of the shoulder joint.
So some of that pinching that people get or impingement?
Yeah, yep. So a lot of times exercises are done, like even a simple bicep curl. If you're doing it with spine rounded forward, shoulders coming forward, you're curling, you can work the biceps, but it's not the most healthy position for the shoulder. So if you can hold front of the ribs down, lift chest, shoulder blades naturally drop down, lock on the rib cage. That socket helps to support the ball, puts the rotator cuff in its optimal position to do its job of stabilizing the ball in the socket.
So setting the foundation first before you do anything in the gym. So aligning your posture, setting up all the good tenets of, like you just said, shoulder blade position, thoracic spine, before you start lifting the heavy weights.
Yes. And even as you're doing good, like rotator cuff strengthening exercises, there's a difference in doing that rotation here and, again, front ribs down, chest lifted, and doing that here.
I totally agree with that. I almost feel like it's better to like not do the exercise if you're going to do it in horrible posture.
Yeah.
You know, I love your advice for our viewers that the foundation or setting up that good postural base before they perform the exercise is probably the most important step for preventing injury in the gym.
You're reaching up overhead into the cabinet for something, ribs down, chest lifted, protect the shoulders.
Love it. Well, thank you so much for your advice, and we will see you soon.
Yeah.
I'm here with Rick Wagner, another one of the therapists who works in partnership with our company. And Rick, let's hear your answer to what advice would you give people or gym goers to not hurting or maintaining the health of their shoulder when they're in the gym?
Yeah, Ben, we've been together now for more than 20 years, and I've treated a lot of shoulders, primarily rotator cuff impingements or pinching of the tissues between the top part of the shoulder blade or the acromion and the front part of the humerus or the arm bone. And what tends to happen is when people train, they tend to train more chest versus training an equal balance of your chest and your back or your interscapular muscles. And over time, what'll happen is you get a tightness in through the pectoralis muscles in the front and a weakness of the interscapular muscles in the back. And as that happens, the subacromial space can narrow and you have a tendency to pinch some of the tissues between the bone here and the arm bone here, causing that front of the shoulder pain.
What have you seen as far as, so imbalance in how they're designing their programs? Maybe they're focusing too heavy on the front of the body, not enough on the back. Have there been any specific exercises that you have seen that have been problematic for the shoulder over the years that have created lots of patients in the clinic?
I would say upright rows tend to really grind those tissues.
My least favorite.
Really strict overhead press or lat pull downs, pulling behind your head. Also another one that can really compress those tissues.
You don't see that one too much anymore. The good old lat pull down behind the head. That used to be a mainstay in the gym. That one's kind of like died.
Bad form dips can do it every time. But a lot of those exercises, if done properly, can also be very safe.
Could you show Jeremiah and I an example of maybe one of your favorite exercises to kind of work on that, what you were talking about, that balance of having those more strongly developed muscles in the posterior versus the front?
Yeah, absolutely, I can, Ben.
Thank you.
It's not just the imbalance, it's the positioning, it's the over-activation of your upper traps and the inhibition of your middle traps, lower traps, and your serratus anterior, some of the scapular stabilizer muscles. But I'd be happy to.
Okay, let's go. Let's go out there. Let's go check this out.
All right, Jeremiah. So the exercise we're going to work on is going to be to break some of the bad habits that a lot of people have, as far as the way that they recruit to stabilize their scapula. And so we're going to use the lat pull down machine, but we're going to do it in standing. So go ahead, grab onto the bar, take a half step backwards. Try to have your spine in a nice neutral position. So body's nice and straight, core is engaged. As you pull, you're gonna really try to activate middle and lower trap, bring the bar down towards your armpits, and then slowly releasing back up. The more you do, the better you do. You really wanna feel the firing here and have almost no activation through those upper traps. So if it's a percentage-wise, it's going to be maybe 80%, 90% firing middle and lower trap, 10, 20% upper trap. You can get a little pause at the bottom and then release. These muscles are for control and stability. So always have tension on that muscle, always be in control, and really try to limit any sort of jerking or quick pulls through the movement.
All right, Rick, thank you so much for your advice for our viewers, and I would love to have you back on soon to deep dive in a little bit more.
Ben, that sounds great. Let's get after the scapula.
Perfect. All right, what'd you think?
That was great. A lot of good information there.
We're going to have some of them back on the show at some point.
Yeah, so expect future videos diving a lot deeper into the science behind that, the more anatomy-based
I love
videos.
Nice. Wait.
Kill that.
I love the nerdy stuff.
Yeah.
But if you guys have any suggestions for us for videos, I've been seeing some of those come through on the comment stream, so thank you. Give our video a like, subscribe to our channel, and let's keep this thing rolling.
Yeah, and you know, one more thing. If you have friends or family who are new to exercise and they don't know how to begin and you want to help them out, some of the best information you can give someone is how to not get hurt. And that's our specialty.
Well said. Well said. Bye.
Have a good day.